Why, hello there, and welcome to Health at Home, where we will be discussing how to keep mentally and physically healthy and happy during quarantine, as many of us are following shelter-at-home orders. Small businesses are suffering, unemployment rates are skyrocketing, kids are being homeschooled, universities have moved to virtual learning, and grocery stores are out of dried goods. Things have changed, to say the least. We want to bring a little light into your day as we will give some personal insight into the experiences we all face and how this impacts our overall well-being. So, let's get into it. So I'm going to open up the floor to Sydney Johnson. And Sydney, what have you learned during COVID-19 through your virtual learning classes? I know it's a difficult situation to be in, and I was just wondering what your biggest takeaways are.
Right now, one of my classes is Sociology of Health and Illness. The content that we're focusing on right now is health disparities, like access to resources, and a lot of these people are relying on their job and they may be deemed like essential workers right now, and they may be having to go and work as like a cashier at the grocery store, and that's totally exposing them to way more than people who have the privilege of sitting at home all day in isolation or working from home. And adding more to that, I think like the modern delivery services right now, like there's Uber Eats and like Instacart, like those are all really great, but you have to acknowledge that like people who are more disadvantaged or these marginalized communities are going to be relying more on work at this time, and that may disproportionately affect how they are exposed to the virus.
Thanks, Sydney, for that insight. You bring up a great point about health disparities. I'm currently researching the impacts of maternal health during this pandemic, and it's no shock that hospital beds are being filled with COVID patients. Hospitals are highly impacted in large cities and rural areas, and we need to protect our mothers-to-be. So midwives and doulas are increasingly being used now as women are choosing to give birth at home. It's really important to keep in mind that this may be really risky due to antibiotics, anticonvulsants, and clean birthing environments. And this definitely relates to health disparities because not everyone has access to those resources. But although this may be a positive thing, as a lot of Western medicine is intrusive to the natural birthing process. So I think that this could be a revolutionary time to maternal health. We need to ensure the safety and insurance coverage for these services. But I really think that we're moving in a positive direction in this sector. So now I wanted to open it up to Abigail Schachter. And what are you learning, Abigail, about the impacts of media to one's mental health during this time?
Social media has done a lot for increasing mental health awareness, including eating disorders. However, some cope with their own mental health issues through humor, which could potentially result in the normalization of these otherwise serious illnesses.
I think during this pandemic, a lot of us are experiencing a lot of anxiety, and I was just wondering how you deal with your anxiety or just how you tackle the obstacle of going to the grocery store.
Going grocery shopping with my mom or my dad, going into the store with a list and kind of an idea or a plan of what we're going to do, wearing a mask, all of these things have reduced any of the anxiety I've felt towards going grocery shopping.
Yeah, a lot of people are struggling with body image and their physical health. And now we're going to introduce Soko Suzuki. Soko, how do you think that obesity will be impacted from COVID-19, or how COVID-19 will impact obesity?
But interestingly enough, according to worldobesity.org, those who have heart disease or those who are obese are going to have much more complications if they contract COVID-19, and so they will have higher likelihood of pneumonia, and they will have a much higher mortality rate. And I think this is really important to know because the United States has a very high obesity rate, and there are a lot of concentrated areas of obesity. And so it's important to focus on those areas and those who are more at risk to minimize the probability of them having devastating results from this pandemic. So yeah.
Yeah, the idea of health disparities really increasing during COVID-19 ties together all of our ideas and concepts, and we really are aiming to just increase one's individual health and well-being. So if you are stuck at home, just know that what you are seeing online, the videos that are going viral, those aren't the things that people are dealing with daily. The things that people are dealing with daily are a decreased access to care, a lack of insurance coverage, depression, anxiety, sedentary behavior, changed birth plans, and many more. As this may be detrimental, we want to uplift you to do what you can at home to increase your overall well-being. To all the listeners out there, stay healthy at home.